Okay, hello, Assalamualaikum Prof, dengar tak?
Salam, sorry, Assalamualaikum. Sorry,
Okay.
a bit late lah the meeting. Can you see the screen?
Yes.
Boleh, minute. It's moving, gerak kan?
Yep.
Okay, Assalamualaikum everyone. Thank you for joining the Fri-Date hari ini. First of all, again, minta maaf lah, a bit late. I think ada another concurrent meeting going on at the same time. Okay. So, topik yang diberikan untuk hari ini adalah rawatan plastik dan kosmetik, pilih pengamal yang bertauliah. Okay, I think the reason, slide saya mungkin dalam bahasa Inggeris, tapi kita, I think let's just be a bit informal. Kita boleh cakap rojak-rojak campur lah, bahasa pun tak apa. As long as I think the whatever the important aspects is conveyed kan. So I think in this lecture what I would like to highlight is that sekarang ni memang rawatan kosmetik ni berluasa jugalah kan. You can see it everywhere. I think setiap rumah kedai, direct rumah kedai, you kan ada satu 7-Eleven, you kan ada satu aesthetic clinic. I think that's what we see now. Tapi what we see sekarang ni kebanyakan, atau bukanlah kebanyakan lah, atau banyak daripada prosedur yang dibuat adalah dibuat oleh bukan doktor, ataupun dibuat oleh doktor tapi yang tidak bertauliah atau tidak berkelayakan untuk buat prosedur itu. Dan komplikasinya adalah quite bad. We see a lot of complications. Jadi mungkin in this talk I just want to highlight, kalaulah siapa nak dapat rawatan, at least pilihlah tempat yang betul, doktor yang betul. Okay. Saya Shah Jumaat, saya adalah Timbalan Pengarah Klinikal Pembedahan di sini dan juga merupakan seorang pakar bedah plastik dan estetik di Masa. Secara introduction, I think yang ni adalah yang seperti katakan tadi, kosmetik ni memang, pembedahan kosmetik atau kosmetik sedang meningkat lah, especially kat Malaysia sekarang ni. Malaysia mungkin kita ketinggalan sedikit. Thailand, Singapore, I think dulu lebih kadarnya lebih tinggi, tapi we have been picking up. And I think you pun dah dapat tengok kan, you kan rasa rawatan kosmetik ni kebanyakan tempat dah ada, banyak klinik dah ada, dan you dapat a lot of invitation on social media especially kan, banyak advertisement for cosmetic work. So you can see numbers in Malaysia are increasing. This is figures from ISEPS. ISEPS is International Society of Aesthetic Plastic Surgeons. Okay, ialah for plastic surgeons only yang membuat rawatan kosmetik. Numbers these are the numbers that have that kita adalah 30,800 procedures in the last year. Dan in 2024. Okay. And these figures actually underreported. Okay, kalau plastic surgeons are doing nearly for 31,000 procedures, that means kalau kita campur dengan doktor kosmetik yang lain, this 5-6 kali ganda lah prosedur yang dibuat di Malaysia. So, and these numbers are increasing. Okay, so you can see rawatan ni semakin diterima dan semakin meningkat. Okay. This is the rawatan utama yang ada. Okay, pembedahan, liposuction. I think kita semua ada dengar liposuction, sudut lemak kan. Kita pembuat a lot liposuction kat Masa. So liposuction, breast augmentation, yang ni increasing the breast size, eyelid surgery, rhinoplasty, abdominoplasty. Yang 5 yang top 5 surgical procedure. Okay. Dan what is more, benda yang lebih popular adalah benda non-surgical kan, atau kita panggil minimally invasive, iaitu botox injection. I think all of us have heard that, untuk nak ketatkan muka. HA, hyaluronic acid, macam filler kan. You've heard all these fillers around, skin booster, itulah HA. Okay, hair removal dan juga all those other lasers lah kan, juga dibuat. These are very popular because they are tidak melibatkan pembedahan, klinik prosedur, datang ke klinik, dapat prosedur dan boleh balik. Okay. Dan it is important. Again, saya nak ingatkan lah, I think important thing here is that you must make sure kalau you nak dapat rawatan ini, doktor dan klinik itu adalah klinik yang bertauliah. I think that is very important. Okay. And you can see again numbers, just nak tunjukkan di numbers for cosmetic or popularity for cosmetic procedure memang tengah meningkat. And you can see there's a lot of money in it. That's why you can see a lot of businesses out there doing it. Okay. Kadang-kadang a lot of people ask, okay, plastic surgery, is it cosmetic surgery? Is plastic surgery reconstructive surgery? Perbezaan di antara reconstructive surgery dengan cosmetic surgery. Okay. Yang ni, this is what we see. So reconstructive surgery ni adalah we are doing something back to normal, macam either after accident, after cancer, after mungkin dilahirkan dengan certain defect kan, kita nak kembalikan ke normal. That is reconstructive surgery. Okay, procedure untuk mengembalikan or something back to normal. Okay. Cosmetic atau aesthetic is something that you are normal tapi you nak enhance, nak membesarkan sedikit, nak menghijikkan sedikit kan, tapi you are normal. It's considered normal tapi you feel your nose need to be a bit higher, you feel your breast you need a bit bigger, you feel your butt needs to be a bit bigger or smaller. That is cosmetic. Okay, so dalam cosmetic ni, the patients are normal patients, they are well. Okay, but they want something done. So that's where you're dealing with a different set of people. A lot of people don't call them patients kan, because they are well, so they call them clients. Now, see the terminology is used kat luar ni, these people are clients and not patients. So you can see reconstructive kembali ke normal, cosmetic adalah normal nak bagi lagi cantik ke lagi, you want enhance. Okay, that's cosmetic. Okay, so I think this is quite clear. This procedure kita buat ni kat rasa cleft lip. So this is reconstructive, kembalikan ke norm kan, daripada rekahan bibir kita nak cantum balik. So this is reconstructive work. Again, this is something about nose kita do. So this is still considered reconstructive pasal this patient is a cleft patient. Bila you have cleft patient, your nose is a bit flattened. So we do some surgery to increase the height of the nose. So yes, some people say this could be considered cosmetic, but in this case it is reconstructive because you're bringing someone back to the norm. Okay. This, yes, liposuction. Now, okay, the hips are a bit big, you want to smaller it, you want to reshape it. Okay, this patient is well. So yes, in borderline you can consider this as a bit of a cosmetic work because patient is well, you just want to tidy up the thighs kan, dia kena kecilkan sikit dia punya peha. So that's where liposuction comes in. So this can be considered cosmetic work lah. Okay. So what is beauty kan? Yang tu pun satu. If you are dealing with cosmetic, you have to understand what is considered beautiful lah. And masalah beautiful ni is different kan, tempat ke tempat, culture ke culture, zaman ke zaman. Kan tengok macam gambar-gambar ni, these ladies are considered beautiful in their respective culture lah, their respective places where they are kan. Someone with a long neck is considered beautiful, someone with a big lower lip beautiful, long ears, these are considered beautiful. Tapi if someone comes to my clinic and say I want my neck to be long, of course I will not do it lah kan, because that's something beyond norm. I think you should not do it. But if you are involved in the beauty industry, you have to understand what is the current trend. I think that's also just important lah. Dan masalah trend ni dia berubah kan edaran zaman. Kan you can see kan, okay, this photo for example, ancient Egyptian time, what is considered beautiful at the time, slender, narrow shoulder, high waist kan, dia nak symmetrical face. So very slender, dia kecil. Dia like someone petite, it's considered beautiful at that time. Then dia ubah sikit, maybe a bit bigger, plump, full bodied, someone a bit heavier is considered beautiful. And then balik kepada slim balik, what's considered beautiful. So you can see things are moving, besar kecil kan. And now what's considered beautiful can change. And I say this cycle will change kan, accordingly. So dia memang berubah lah according to zaman. So you can see this, right? I mean, I think something that really shows the change of what's considered beautiful has changed over the time, and this cycle will change. But pakaian is same, right? Dulu I think when we were young, this skinny jeans kan, then after that bell bottom, straight cut. Now sekarang balik kecil balik. So you can see this things changes according to time, and the cycle always changes. So That's something that we have to always keep abreast with lah. For a patient, maybe there's something also I think is good for everyone to know kan. Sebelum we operate on anyone lah, especially for cosmetic lah, because these people are well lah. These people are clients, patient datang ni dia well kan. So kita kena tengok juga patient ni suitable ke tak. So we have to assess the patient juga kan, because other patients sometimes they come in, dia ni maybe they have a lot of them might have some psychological issues beneath. So kita kena assess the patient, are you a suitable patient for cosmetic work? So these are what we look at lah sometimes kan. Kalau someone is secure, young, listens, intelligent, dia faham, you can communicate well with them and they understand, they act normally, then maybe these are the patients that are suitable. Ada juga benda people that come in, nampak macam they don't know what they want, they force you, dia paksa, saya nak operation besok juga, dan dia tengok and their complaint, kadang-kadang the complaint tak tally lah dengan presentation dia. For example, dia cakap lah, maybe I have a pigmentation over the cheek, tapi you don't see a pigmentation, maybe a slight pigmentation, but it's really affecting them. So this something is not right. So these patients better not operate on them because they will never be happy. And the moment you operate on them, I think you have a difficult patient. So the good thing about cosmetic, good thing lah, kira good lah kan. If you feel you don't have to operate on them, you can say no because these patients are well anyway kan. So whereas for reconstructive work, you have an obligation to treat. Tapi for cosmetic, you can say no if you feel the patient is not right. Right? And you see, I think everyone knows, I'm sure everyone has seen her before. This lady, she wants to look like a lion. That's her object. She's since passed away. But her role is, she wants her face to be like a lion. So she had multiple operations done. My concern is that she found a surgeon to actually do all this work for her. So this is something like from a surgical point of view, from the doctor's point of view, kita tak patut buat lah kalau what she wants is not normal kan. You should not do this surgery. You can say no, but I guess in her case, she actually got the surgery, she got the surgeon, she got the practitioner to do what she wanted. Alright, she since passed away, but anyway, you can see there are people like this. There's definitely a psychological aspect to this, and that has to be rectified. Okay. Just a bit about Malaysia. Sekarang ni kita ada about 130 plastic surgeons in the country. And this 130, mungkin 50% are in private, 50% kat public. So the 50% of private practice, they're the ones who do most of the cosmetic work. The public surgeons are mainly doing reconstructive, a bit of cosmetic. Alright, so these are the numbers. Tapi numbers doctors yang boleh buat cosmetic procedure, buat non-surgeons, Malaysia only 1,125. These are registered practitioners yang boleh buat cosmetic work. That means GP, dermatologist, pakar kulit, pakar bedah, total adalah 1,125 sahaja. Because these numbers are so low, the demand is there. I think this is where kita dapatkan beauty center banyak buka, semua tengah buat prosedur. Okay, legally beauty centers cannot do any medical procedure. They cannot do any injections, they cannot lagilah tak boleh buat surgery. So that is clear. Guideline kita, regulation kita memang tidak boleh buat. Beautician tidak boleh inject anything, they cannot use any medical device, they cannot use any lasers, dia tidak boleh buat. Tapi it's everywhere because the demand is there. I think not enough doctors to do it. Okay, so that's where complication occurs. So this is some, I won't bore you. This ni ada regulation kat Malaysia. Dia ada satu doctors yang boleh buat cosmetic work adalah terbagi bertiga. Chapter 1, 2 and 3. Chapter 1 lah GP, general practitioners yang nak buat non-invasive work, macam inject, filler, botox, lasers. Ada 874 sekarang. Chapter 2 adalah pakar dermatologi, kebanyakannya pakar dermatologi, dia 125. Dan chapter 3 kebanyakan plastic surgeon lah kan, yang boleh buat adalah 126. So total 1,100 lebih saja in the country currently who have yang dapat kelulusan, yang dapat credentialing daripada KKM untuk buat cosmetic work. So that's where regulation comes in lah. Kenapa kita kena regulate kan? Adalah disebabkan inilah. You see kan, newspaper I think every 2-3 days, every week you kan nampak lah kan complication of cosmetic work, macam-macam ada. And then a lot of complications occur. Patients datang Tapi tengok dia buat, tidak dibuat oleh doktor yang bertauliah atau tidak dibuat oleh doktor langsung. I think tahun lepas, if you remember, I think 1-2 tahun lepas di Sepang, ada raid from KKM dengan bahagian immigration, raid satu tempat estetik, rumah kedai, jumpa seorang orang Vietnam. Ditangkap this Vietnamese lady, datang ke Malaysia sebagai cleaner. Bertugas sebagai cleaner, tapi entahlah she happened to open a business buat cosmetic work di Sepang. Okay, so of course got caught and then sent back, like immigration tangkap and sent back home. But you can see, a Vietnamese cleaner is doing cosmetic work in Malaysia. So you can, I mean, the demand, because the demand is there, and mungkin pasal tak cukup doktor jugalah. So if you want, you have to make sure kalau nak dapat treatment lah, dapatlah treatment oleh orang bertauliah. Okay, you can see a lot of complications occur in newspaper. You see this, I think I won't bore you with this, tapi selalu ada lah complications that occur, and it's been highlighted in the newspaper recently. Okay, so why regulate? Again, public safety. Make sure, kita kena ensure that kalau the public or someone wants cosmetic work, kalau pergi klinik yang bertauliah akan di-treat oleh doktor yang bertauliah, treatment dibuat di tempat yang recognized bertauliah, dan prosedur yang dapat betul lah kan. Inilah untuk to reduce the complication rate. Okay, so public safety important, place of practice important, also protects the doctors kan, because if you are qualified to do, complications can happen, tapi you know how to treat the complication because you are trained. I think that's important kan. So sekarang ni kalau beautician buat complication, dia akan hantar ke klinik ataupun finish, the patient is on your own kan. You have to carilah. So all these people eventually datang ke klinik kerajaan, hospital kerajaan untuk dapat treatment. Okay, so sekarang Malaysia macam mana kan, beautician versus GP kan. You have to make sure, if you beautician dia ada prosedur dia boleh buat, facial, manicure, pedicure, beautician boleh buat. Tapi prosedur yang melibatkan injection, melibatkan invasive or non-invasive, beautician cannot do it. They cannot do any lasers, they cannot do any injections, injectables, tak boleh. Okay, dia kena a doctor yang bertauliah. Okay, so sekarang ni that's a problem. So sekarang ni pula GP pula ada yang buat benda yang tak lebih yang diperlukan kan, like they can only do, dia boleh buat injectable saja, dia tak boleh buat lah surgery, double eyelid ke, nak masuk implant tak boleh buat. Right? So you need someone who is a bit more qualified. So this is where kita ada regulation tapi dia campur because of the demand, people are doing a bit more than they want to do. Okay, this is just an example of a letter daripada KKM yang kata prosedur yang kita boleh buat lah. You can check this. Alright. So sekarang ni current landscape in the country, there's a lot of money in cosmetic work lah. Kan? So semua orang nak buat. So that's where the public has to be a bit more careful untuk pilih. If they want procedure done, kena make sure the person, the tempat adalah bertauliah. Right? And how do we do it lah kan? I'll let you know. Kita boleh check. It's very easy to check if the doctor is recognized or not. Okay. So we have to do sekarang ni, kenapa all this happening is because I think tak cukup lah doktor kan. Dia ni 1,100 lebih je doktor yang boleh buat kosmetik kat Malaysia. But you see number of clinics outside is more than that. So obviously something wrong, something's not right. So you have to make sure. So take your own responsibility. Satu lagi, the other thing happens is you are, patient sekarang ni pun nak benda yang murah kan. They want to go for the cheapest solution. That is also the problem. Alright. Proper, if you use the proper instruments, you use a proper medication, kalau guna filler that is recognized, that's MDA approved, you guna botox, toxin, that's medical approved, it is expensive. The price is not cheap. So you have to be careful, you know, if you cannot expect to pay cheap and get good quality results. I think that is also something that we have to look at. Kan? You can avoid your own research because you have to understand things are good quality products can cost more. Okay, so again, if you have pay peanuts, you get monkey size. So this is just, I know, a bit crude, but you have to be careful that going for the cheapest might not always be the best. Okay. And you can see, kan, this late came out, I think, a couple of years back. RM60 to lesung pipit. Come on, this is something tak logic, kan? You want to do a procedure like this, it's definitely 600 is. And dia buat, and this is done in the shop lot somewhere kat bilik belakang, you know, it's just quickly done by someone who is not a doctor. Okay. Okay, so this issue did come up, and then they asked opinions from me, and we said, this is something that should not be done at all. Okay. So conclusion, I mean, yes, it's important to regulate, kan, adalah untuk make sure everyone is safe. Okay, tapi the public has to be aware, and they must take responsibility if they want to ensure that their doctor is certified, the place is certified. So we have the safety diamond, kan kita panggil. So right doctor has to be qualified, right procedure by the doctor who's qualified. So if you are not sure, you can get second opinion. Dibuat di tempat yang bertauliah, proper clinic, a proper hospital, and treatment is done to the right patient. So these are the 4 safety aspects of the safety triangle yang kita selalu promote lah. Right doctor, right procedure, right place, and right person. How to check if your doctor is recognized? Okay, it's all on the website. You have to do at least 2 things. 2 benda. Satu, check that doctor ada NS, is a doctor or not lah. So you can go to MMC, merits.mmc.gov. Pergi search a doctor, type the doctor's name. If the doctor is registered, has an annual practice cert, akan keluar nama doktor tu. Okay, so you can check. So always check is the person is a doctor. Second, the person ni boleh buat cosmetic work ke tak. So Ministry of Health, kita punya KKM website ada. Dia ada senarai semua doktor yang boleh buat prosedur, yang bertauliah untuk buat prosedur kosmetik or estetik. So 2 things, please check. It's all on the website. You can check yourself. Okay, check doktor tu bertauliah, is a doctor or not, medical doctor or not. Because sekarang ni a lot of clinic ni dia not medical doctor, dia buat PhD kat wherever they do, they call themselves doctors. Okay, so they're not medical doctors. So the person has to be a medical doctor. MMC website on merits, and then you check boleh buat kosmetik ke tak on the Ministry of Health website. Okay, so it's easy, you can check yourself, and please do that. You have to take ownership, because sekarang ni you tengok a lot of beauty center, they looks like a clinic, tapi they're not run by doctors, so be careful. Alright, with that, thank you. I know Korea is a place that all cosmetic work is all done, so we recently, last year, kita pun signed the MOU with the Korean Society of Plastic Surgery lah, so we can send our trainees there to learn a bit about Korean cosmetic work. Okay, thanks. Thank you very much.
Terima kasih Prof. Baiklah, seterusnya kita buka untuk sesi soal jawab. Sekiranya ada pertanyaan boleh type di ruangan chat.
Ah,
Okey, Prof ada satu soalan daripada saudari Nur Hazika Rusmi. Salam Prof, saya ada diagnos congenital nasal deformities dengan
Telecanthus, okay. Thank you. Nur Hazika kan yang I saw. Waalaikumsalam. So saya ada diagnose congenital nasal deformity dengan telecanthus since birth. Dekat Hasa ada juga kes seperti ini. We can see if you want, because this congenital deformity not very often kan. But I hope are you getting treatment anywhere? Are you getting any follow up? If not, you can come to our clinic. Kita pun boleh. We can offer some advice and we can assess lah. Nak tengok any procedure needs to be done or not. But we can see, and we have the capability to treat lah. Kita boleh tengok. Okay. Dah dapat appointment, I think quite easy. Just come to our clinic. We see our clinic dapat surat rujukan. Then come to our clinic. Our clinic every Wednesday pagi. Share bagaimana cara untuk rawat burn. Okay, yes, burn memang is a bit is very common lah kan, especially kids. Kita pun what we see is 40% of our patient burn kita yang datang kat Hasa ni ada bawah 12 tahun. So large percentage of patients are burns. And the thing about burn is, I think you dapat rawatan awal, proper rawatan, I think it can heal quite well. So the important adalah untuk at least dapat rawatan awal. Second thing is the first aid too important. Kalau berlaku burn or anywhere air panas ke apa, the first thing to do, that first aid is very important. First aid dia 20 minutes bawah running water. You buka pipe, put that area under the tap for at least 20 minutes. First aid dia, very important. And that's what we tell. Then balut dengan kain bersih, datang ke hospital atau klinik yang berdekatan. Alright, and then from there we can take the treatment from. So the first aid is important. Tak kisahlah kanak-kanak ke dewasa, the first aid is very important. 20 minutes under running water. At least 20 minutes. Balut dengan kain bersih. Come to the hospital. Alright. And tak boleh guna Colgate dan tak boleh guna kicap lah. Please don't. Colgate, kicap, telur. Kan all this, I think the problem is this is dia satu, it can cause further infection. Dua, dia boleh cover the burn dan kita tak boleh assess dalam burn tu. Okay, so I know dulu kita guna kicap, kan, kita guna Colgate, even telur kadang-kadang kan, tepung, all this, no. 20 minutes under running water. Pipe biasa 20 minutes atau under shower 20 minutes. Balut dengan kain yang bersih, datang ke klinik atau hospital yang berdekatan. Alright. Okay, Norzila. So, kalau pesakit ada masalah cleft, perlukan pembedahan, adakah rawatan di Hasa boleh cover GL or self-pay? Okay, thank you. Good question. Don't worry, I think sekarang ni kat Hasa, GL, yes, if anak staff semua, GL can cover. We also, kita dapat bantuan juga daripada Ronald McDonald Charity House. So semua cleft yang ada, yang datang ke Hasa, kita boleh minta bantuan, dia pun boleh bayar. So sometimes kalau ada pembayaran lebih, dia will cover. Kalau tak, GL will cover. Yes. So kita boleh buat rawatan tu, and we have the full spectrum. We can treat the full spectrum of cleft lah kat sini sampai dewasa. Okay. So boleh this follow up under Prof. Datuk Ahmad Rizwan. Yes, Nur Hazika. Before this follow up ada Datuk Rizwan. Tapi this was a long time ago, perlu melakukan craniofacial surgery juga, so this quite risk. This tak ada follow up. Okay, maybe Hazika, you can come to us, Hazika, and then we can take it from there. Let's reassess you and then we'll see what you need and then we can offer lah. So, nak buat, if you want to go back HK pun boleh, tapi let's see you first and then we can do the needful. Boleh? Nazka? So easy, just get a clinic appointment, dapat surat rujukan daripada klinik, just come to from any klinik kat luar, then just come to our clinic untuk dapat tarikh temu janji. Okay, Nurul Fazliana, keloid boleh dirawat tak? Boleh dihilangkan tak? Okay, good question. Keloid is something very difficult to treat. Boleh dirawat. Nak hilang 100% tu maybe a bit difficult, bergantung. Tapi boleh dirawat. Okay, dan depends of course lah, size dia, location dia kat mana kan. Tapi kita ada kaedah rawatan and we provide that service kat, boleh datang kat klinik Masa. Kita boleh start treatment lah kalau perlu. Okay, Nurul Fazliana. Kalau keloid ni parut, so sometimes you are prone to keloid kan. So there are keloid ni range dia macam-macam. Some boleh hilang, some people yes kita boleh it can go off or at least can be reduced. Tapi ada juga keloid yang resistant kepada treatment. Yang tu mungkin perlu rawatan yang lebih agresif lah. Tapi kita boleh rawat.
Okay, terima kasih Prof. Rasanya itu saja soalannya.
Okay, terima kasih. Thank you everyone. Happy weekend. Assalamualaikum.
Okay, nampaknya program kita telah sampai ke penghujungnya. Pihak unit latihan ingin mengucapkan ribuan terima kasih kepada Prof di atas kesediaan untuk berkongsi maklumat pada hari ini. Moga taklimat yang disampaikan bermanfaat kepada warga UiTM dan terima kasih juga diucapkan kepada semua warga UiTM yang menyertai taklimat pada hari ini. Pautan jam latihan akan diberikan di ruangan chat. Kita akhiri program kita pada hari ini dengan tasbih kafarah dan surah An-Nas. Terima kasih Prof dan terima kasih semua. Assalamualaikum.